Welcome here to a new YouTube channel, Surgical Appetizer. First topic, ostomy, stoma, types, procedures, and a simple systematics. This video is based on a German language video on the Chirurgy Appetizer channel, which is a channel here with 15,000 subscribers, 1 million views of the videos, and a total watch time of 151,000 hours. Medical education. And these are the German versions of this video on which the video is based on. You learn here a simple stoma systematics, the different types of ostomy and colorectal surgery. You learn the typical colorectal standard operations with creation of a stoma. You learn which ostomies are permanent and which are temporary. And you learn the different modes for stoma reversal and restoring the intestinal continuity. Stoma systematics. Ileostomy versus colostomy. A stoma can be a loop ileostoma with a double lumen, and it can be terminal with only one lumen sutured to the skin. And a stoma can be temporary versus permanent. Let's start with a loop ileostomy, which is temporary. Protective loop ileostomy. A typical example for a loop ileostomy to be performed is after a low anterior resection for rectal cancer. This is done with a TME, total mesorectal excision, that you will learn in the video about colorectal cancer surgery, where we speak about the rectal cancer operations. And then we perform a descendorectostomy, where the descending colon, the left-sided colon, is sutured to the rectal stump. However, such a deep anastomosis at the rectum can be critical, so a protective ileostomy is performed, and this is done in a loop fashion, so both loops are sutured to the skin. This gives you an idea how an ileostomy is created. The use of a stoma rod is optional to prevent the retraction of the posterior wall. A little bit controversial whether to use it or not in ileostomy. This is how the loops are sutured to the skin. The afferent loop is placed caudally and performed in an everted fashion. We call it also a stoma nipple. This is done for skin protection against the aggressive small bowel contents. Stoma reversal is relatively easy. We perform a simple reanastomosis of both loops, and this usually works without a laparotomy. Second example, loop transversostomy. This is a colostomy in a loop fashion, and this stoma also is temporary. Loop transversostomy is done for locally advanced irresectable rectal cancer, for example, where you first perform the loop transversostomy, with this being the afferent loop, colostomy bag, and so you can prepare the patient for neoadjuvant treatment, and the locally advanced rectal cancer may become smaller, and you can resect it in a second step procedure. Stoma reversal is relatively easy. We perform a simple reanastomosis of both loops, and this usually. Third example is the terminal colostomy. We look at the permanent terminal colostomy first. This type of stoma is required when a rectal cancer in the lower third of the rectum involves the anal sphincter and destroys it and cannot be removed from the sphincter. Then an abdominoperineal rectum extirpation is required, and then there is nothing where we can restore the colon continuity and preserve the continence function. So a terminal permanent descendostomy is created. Fourth type of stoma is the Hartmann stoma. Here we have a colostomy, which is terminal, however, which can be temporary. This is typically done in diverticulitis CDD type 2C2. This classification we'll learn in the video about diverticulitis. So we have a perforation here, free perforation into the abdominal cavity with feculent peritonitis. And in this situation, we need to make a quick operation, and the sigmoid resection is performed in a tubular fashion. And the first one to describe this procedure was Henri Hartmann, a French surgeon in the Hôtel Dieu de Paris. He described it first at the 30th Congress of the French Surgical Association. And this is how it is done. The Hartmann's procedure means creating a terminal colostomy and closing the rectum stump, which is closed in a blind fashion. However, why is this procedure temporary? Because we can perform a Hartmann's reversal operation by restoring the continuity with an anastomosis between colon, descending colon and rectal stump, which can be done in a second procedure. Let's have a quick look at typical stoma complications and their treatment. First, there are the parastomal hernias, which may require surgical correction, e.g. by implantation of a mesh, the so-called sugar bagger procedure. A more typical complication immediately after stoma placement are bleedings, which are usually from the stoma margin. You should have a very close look and identify the site of bleeding, and you can easily stop that with some sutures. Then the deficiency of fluids and electrolytes may require infusions and correction of these deficiencies. Peristomal dermatitis may occur when the stools get in contact to the skin. The peristomal dermatitis may require stoma care procedures. A parastomal abscess may occur and stoma disruption, which may require surgical revision. And problems with the stool passage, constipation, may be due to surgical problems like a tight fascia and a stenosis of the bowel segment caused by that. And also this may require surgical revision. Initially, a placement of the Foley can help, and application of enemas. You know now the differences between ileostomy and colostomy, the differences between loop ostomy versus terminal ostomy. You know the difference between permanent and temporary stoma. You know the typical ostomies after rectum resection, after an anterior rectum resection, the protective loop ileostomy to protect the deep anastomosis at the rectum, which is temporary, and the permanent terminal colostomy after abdominoperineal rectum extirpation. And you know the Hartmann's procedure and the Hartmann's reversal operation. Now I have some appetizer dessert for the surgical interested among you. Two terms which may be useful. The one is anastomosis stoma, the other is split stoma. Let's start with the anastomosis stoma. After right-sided colectomy, for example, when you have performed iliotransversostomy for reconstruction, and you have an anastomotic leakage over here, you can create a stoma which is created of an ileostomy and a colostomy. However, you place these two loops close to each other, so you have the chance to reversal operation by simply anastomosing these loops without a laparotomy after recovery of the patient from the peritonitis. The other stoma is the split stoma, where we suture these two loops to the skin separate from each other, and then we call that a split stoma. And this consists of the ileostomy and a colostomy separate from each other, and the reversal operation requires a laparotomy to re-anastomose these two loops. So this was the first English version of a surgical appetizer video. More videos will come in English language. If you liked it, please press the like button, subscribe the channel and leave your comments in the comments section. The German version of this channel has now 99 videos, a total playtime of 52 hours, and has been viewed 1 million times, and the channel has 15,000 subscribers. Thank you for subscribing. Thanks for watching. See you on the channel.